Hi everyone, thank you for joining the webinar today. We've got a great presentation in store for you. The title of this webinar is Converting from Employer Health Insurance to Defined Contribution Health Benefits. Before I introduce our presenter, Paul Zane Pilzer, the founder and CEO of Zane Benefits, let me just walk through a few key things. If you have questions on the webinar, please type them into the question box. We are not going to be able to unmute anyone due to the sheer number of attendees. Registration and I believe attendance for this event is exceeding 1,000 participants. So please, if there's any technical difficulties during the webinar, please let us know. With that, I'll go ahead and introduce Paul Zane Pilzer, the founder of Zane Benefits. He's the author of over 10 best-selling books on healthcare, the economy. He even has a book entitled Why God Wants You to Be Rich. He's a pretty dynamic presenter, and I think you're going to enjoy what he has to talk about. Unfortunately, during the original broadcast of this webinar, we had some technical difficulties with the recording in Park City, Utah. So we missed the first 5 minutes of the recording. So what I'm going to do is I'm going to summarize the agenda and what Paul Zane Pilzer walked through in the first 5 minutes, and then I will pick up right where the recording. With that, I'll go ahead and get started with the agenda. What Paul Pilzer is going to be covering today, we actually pick up on the second slide here. Is the history of employer health insurance. In order to understand what the history, the future holds, you need to understand the history. He'll then walk through the future of health benefits and what it has to healthcare reform is going to have on the employee health benefits market. He's then going to focus a lot of time, and we got all of this on the recording, so you're going to love this part, on the healthcare cost, the greatest issue facing Americans. He is very passionate about the subject, and I think you'll enjoy it. We'll talk about the cost of healthcare versus health insurance. Paul is going to outline the greatest, what he views as the greatest employer arbitrage opportunity of the decade, allowing employers to switch now from group health insurance to individual health insurance, and how that arbitrage opportunity exists today, and then how it changes and continues based on 2014 implementation or 2014 repeal of healthcare reform. In order to understand how we got to this problem, you have to understand where health benefits started. If I ask the average person today, if I ask everyone on this call, why did group health insurance get started in the first place, most people say it's because individual health insurance costs more. And that's actually an accurate statement. The whole reason employers offer health benefits today has to do with a tax deduction for individual or group health insurance. Let me say that again. It's all about a tax deduction. So the question is, when did the tax deduction start? And that started in World War II. If you're familiar with World War II wage and price controls, this is when the exclusion for employer-sponsored health insurance originates. What I'm saying here is that pre-World War II, there was very limited employer involvement in healthcare. Pre-World War II, that was 60 to 70 years ago, employees and individuals handled their own health care, typically through local Blue Cross and Blue Shield, and health insurance was typically catastrophic. What happened? In World War II, wage and price controls were instituted that took income rates past a certain amount to up to 90% income tax rates. What that meant is if you got paid $1 above that certain threshold, 90 cents went to the federal government. So what the employers did was they said, please let us pay for our employees' health care and let us deduct that and not be subject to these huge wage and price controls. So Congress passed a bill that said, hey, employer-sponsored health care, if the employer pays for it, is excluded from wage and price controls, is also excluded from employees' income taxes. So what this meant was overnight, employer-sponsored health insurance had a huge cost advantage. So the difference between individual health insurance and group health insurance immediately became that group health insurance costs effectively 50% to 90% less than individual health insurance. And this is what has created, if we fast forward 60 years, modern employer health insurance, group health insurance. So from World War II to 2002, group health insurance had an enormous tax advantage. Employers were allowed to pay for group health insurance essentially off the books. They got to deduct it as a business expense. And employees, any benefits that they received were free from income tax. They also, in the 1970s,
instituted Section 125 plans that let employees contribute their portion of the health insurance, group health insurance, tax-free. It wasn't until 2002 that the federal government gave tax parity to individual policies. And in 2002, they documented HRAs, which are health reimbursement arrangements for employer tax-free contributions. If you're familiar with our product, we have a product called Zane HRA that lets an employer contribute to employees' individual health policies 100% tax-free.
All right, this is where Paul Pilzer picks up.
Similarly, that employee can take pre-tax dollars and use it to reimburse themselves for a personal health insurance premium. And that's pretty major and never really took effect. I mean, it took effect legally, and millions of employees, which is not a lot when you think there's 314 million Americans, we estimate about 1 million employees today actually take advantage of what we call a premium reimbursement arrangement. But it really hasn't taken hold because healthcare reform has dominated the news of the last year. So moving on to defined contribution healthcare benefits. Defined contribution health benefits had these two major years. 2002, an employer can give an allowance, fixed amount to an employee to reimburse for premium. 2009, an employee can take his own pre-tax premium and supplement his employer policy. How do I move next? Just up. It's not moving. Is that the go? Is that the next? Okay, so leading up to healthcare reform legislation in 1965, leading up to healthcare reform legislation in 2010, we have these 5 bills, and I'll run through them quickly because they're all very operational today, and effectively none of them changed with healthcare reform. One, of course, is Medicare. The next one is Medicaid, and of course these numbers are the numbers covered today. And notice that Medicare and Medicaid now cover 100 million people. I always tell people that we didn't really need healthcare reform, this is my personal opinion, because we had already done the heavy lifting. Our society had already covered the aged and the very poor, who have enormous health benefits just by definition of being poor often. And then we had covered that in a very big way and taken care of it and funded it to the tune of $1 trillion a year. ERISA came along in 1974, and ERISA has a major role to play in defined contribution health care. And it was primarily retirement and pension reform, but it really covered all employee benefits and laid the basis for health care. COBRA and HIPAA, which people think are health care bills, were not. COBRA was an amendment to ERISA. And COBRA basically did a number of things, but it's the Consolidated Omnibus Retirement Act. But what it really did is it said employees, people who quit employees, are allowed to stay in their group plan for 18 to 36 months, 36 for dependents, 18 for them. It only applies to employers over 20 employees, and that was 1986. And COBRA is still very much in effect. And HIPAA did a lot of things in 1996. Again, HIPAA was an amendment to ERISA. And HIPAA did a lot of things, but specifically mandated that you've got a pre-existing condition at one employer, you switch to another employer. If you don't go uninsured more than 63 days, the new employer's got to pick up the problem of the old employer. And most important, HIPAA in 1996, and this is key, mandated state coverage of uninsurables post-2006. I'm going to say that again. The HIPAA bill of 1996, similar to much federal legislation, said we can't afford this now, but in 10 years, 2006, all states must have a plan to cover an uninsurable. And an uninsurable is defined as somebody who exhausted COBRA, or worked for a company that was under 19 and didn't offer COBRA, or worked for a company that went out of business and or canceled their group plan. HIPAA said that if your employer cancels their group plan, all employees become what we call a medical uninsurable if they can't get a personal policy, and therefore the state has to come up with some type of coverage regardless how sick they are. So HIPAA really said that you may have a person in your state, Mr. Governor, who's a hemophiliac, needs $10,000 a month to stay alive, or a chemo treatment of $50,000 a month, or is scheduled for a heart transplant for $1 million. And when you canceled your group plan, that person has to be guaranteed full coverage by the state at some type of reasonable price. And we can argue what over reasonable is, but HIPAA mandated a reasonable price, and the guideline they said was 2 to 3 times what you pay if you're healthy. Most states charge 3 or 4 times, but it's still a huge bargain. It's in the event that you need health insurance and you're a hemophiliac or need an operation and can't get it in the private market. Let's scroll down. The Affordable Care Act came along in 2010. And I want to put this back in perspective. In 2009 and 2010, when we debated the Affordable Care Act, this was the hallmark legislation. This was bigger than unemployment. This was bigger than any economic issue. This was the dominant issue facing America, what to do with, now they call it Affordable Care Act. Remember, this thing started out as, why don't we convert to a single-payer system like Europe? Why don't we go to a system where all doctors and all nurses work for the federal government? And, of course, a lot of people didn't like that too much. And the end result was the Affordable Care Act, ACA, also called health care reform. And the first thing it did was it mandated a generic national health policy. And by that I mean they set a minimum. The Affordable Care Act said that starting 2014, all, ALL, policies called health insurance must cover psychiatric without a deductible, must cover all these different drugs. In effect, every lobbyist in the medical industry, which is 1/5 of our economy today, descended on Washington and made sure the Affordable Care Act had something for them that mandated their product be a good product. So it didn't say health insurance, federal government must have this, but it said it must have at least this. And their definition of at least this was what I call the Goldman Sachs healthcare plan. It was much more than most plans gave for their employees. In effect, the government minimum, in my opinion, became the policy. So where we are now is that with the final implementation of Affordable Care Act on mandated benefits for all policies, we have created something called health insurance that's a national standard. Now, don't go crazy and think that's socialism. We had that before. All 50 states had a state standard of their health insurance. If you lived in Texas, for example, any policy sold in Texas had to have a $3 million lifetime max. If it was in California, it was a $6 million lifetime max. If it was in Utah, it had to have a $1 million lifetime max. And in fact, the federal government said, you're all out of business, states. We have a new lifetime max. It's called unlimited. All policies have to have an unlimited lifetime max. That was one of the things passed in Affordable Care Act. Second, the Affordable Care Act mandated all Americans must buy health insurance. Now, it sounds terrible, and you've heard all the lawsuits, how horrible it is they're mandating everyone buy health insurance. But it's not much of a mandate. If you don't buy it, Mr. American, you, not your employer, have to come up with $750. So if you're a poor guy walking down the street and you haven't bought health insurance, we could technically arrest you for a misdemeanor. But the amount of money is only $750. So hopefully, it's not a lot of money. But of course, that mandate is pretty light. If the mandate was $10,000, remember we're going after here with the mandated purchase for all Americans. We're going after what we call the young invincibles, the 28-year-old making $100 grand a year who won't contribute to health insurance. I don't think there are many people like that, but the government seems to think there are a lot. And we want to make that guy buy health insurance. But when they're all done, the mandate dropped from $10 grand to $750. In other words, it's not much of a mandate. We also mandated guaranteed issue for all individual policies. Now, this is the big enchilada on health care reform. Effectively, we have said that starting 2014 and starting 2010 for children and starting 2011 for an adult who hasn't had health insurance for 6 months, that's called PSIP, we'll come back to that, and starting 2014 for everybody, all policies are guaranteed issue. So quickly do the math. I need health insurance. I'm thinking I'll have a baby. But I'm not planning to have a baby for a couple of years. So why don't I go get pregnant and wait till I'm 8 months pregnant and a week before the hospitalization buy health insurance? Yes, you can absolutely do that. There's no real reason in a guaranteed issue world why buy insurance, because if you can always buy it after you get sick at no additional cost, you'd wait. Now, of course, to keep that from happening, they put in the mandate saying if you don't buy it, we're going to tax you $750 a year. Well, if you're saving $5,000, $10,000, $20,000 on health insurance, I don't think the $750 is going to help you. Part of the reason is that $750 should have been a much bigger number when they originally debated the bill. So where we are today is these bullets, children became guaranteed issue in 2010. Adults uninsured for 6 months now are now guaranteed insurance from a federal risk pool, which is really good coverage, by the way. And everybody becomes guaranteed issue on January 1, 2014, roughly 15 months away. That's pretty major. Separately, Affordable Care Act made a major expansion of Medicare eligibility. Not the subject here, but keep in mind that this was what the states won before the Supreme Court, where they said that the Medicare eligibility expansion is something we may not want to participate. And whole states, led by Texas, I believe, are going to drop out of expanding their Medicaid eligibility, which is still going to leave tens of millions uninsured, effectively the governors of the states have said health insurance is very important, but jobs are more important, and we really want to take care of jobs. Maybe we want to take care of our very poor or health care. It brings up the whole discussion of what is health care. I'll touch on later if it's a civil right or not. I'm not going to have an opinion on that. I just want to lay out the framework for you of the discussion. So the future of health insurance for employer health insurance as we head towards 2014 is that, and we're going to cover this in more detail in later slides, health care reform 2014 massively favors defined contribution. Defined contribution, for those who have joined me new or haven't been following some of these webinars, is nothing more than what it sounds like. An employer defines a contribution towards your health care, just like they define a contribution towards your retirement. And that amount is all you get. You go buy your own health insurance. And pre-2014, it was really tough to buy your own health insurance. One, it's medical underwriting. Two, is no federal subsidies for individual. They had to buy it for yourself and pay for it. After 2014, anyone can walk down the street and buy health insurance. They're not allowed to ask you your medical history. And massive federal subsidies exist if you buy a policy. So the cost advantage shifted to 2014 to the individual system. We'll cover this in more detail. So, effect healthcare reform covers a huge amount of healthcare reform massively favors defined contribution and individual policies.
We're going to pause here for just a moment. A lot of the information here on healthcare reform, a lot of good information. So we're just going to pause for a quick moment, see if there are any questions coming upon the online webinar. Just give you a minute to digest the healthcare reform information. With that, we'll let Mr. Pilzer continue.
Good. This is Professor Paul Zane Pilzer discussing defined contribution health benefits and healthcare reform coming in 2014. And what I put together here is a little timeline, and I apologize for getting a little personal, but as many of you know, I'm the founder and former CEO of Extend Health, which we just sold for $435 million, a little commercial, to Towers Watson on May 29th, and also the founder of Zane Benefits. And I want to run through this whole personal timeline here of where these have affected me and my companies, because that will also help you understand where we see healthcare reform going. And frankly, you may not agree with me, but it's important that just like you may need to know what church I go to if you want to talk theology with me, I'm going to give you a little background of where I go in terms of my healthcare church and what my background has been. In the 1970s, I worked at Citibank. And at Citibank, for my 5 years there, the big issue of the day was that our clients, Fortune 500 companies primarily at Citibank, were effectively actuarially bankrupt. And let me explain why. In the 1970s, a typical Fortune 500 company had a defined benefit retirement plan, not a defined contribution plan. So in the 1970s, a typical company, whether it be GE or Exxon, or then it was called Esso, I guess, Standard Oil then, had a plan that said, when you work for us for 30 or 40 years, if you live past 65, we will pay your defined benefits. We'll pay your cost of a house, cost of food, and it will raise it every year. And unlimited till you die and your spouse dies. And that was the deal for working for a Fortune 500 or a large company back in the 70s, which really started back after World War II. Well, what, of course, happened? Life expectancy went from 50 to 84 from World War II to 1980. And all of a sudden, these companies were looking at enormous defined benefit unlimited retirement obligations. And the actuary said, they're all broke. There's not enough money for them to keep paying these 70, 80, 90-year-olds who are living longer their defined benefit retirement. Many of them did go broke, but most of them converted to defined contribution. The 1970s in retirement, particularly regulated by ERISA, and I lived through this at Citibank, was the shift from defined benefit plans, will give you a benefit to feed you to and house you till you die, to a defined contribution. You work for Citibank, for Standard Oil, you get retirement. How much? How much did you put in? And we'll match it. And we invented something back then called the IRA, and also in the 1970s invented the 401k. And everybody said back then, people are too stupid to manage, literally, too stupid to manage their retirement. You can't let people put money in an IRA and buy stocks. You can't let people put money in a 401k. They'll go broke. They're stupid. We need to manage their money. Well, they was wrong. The people managed to figure it out. And today, about 120 million Americans, I'm pretty proud of this, have an IRA or 401k and manage their own retirement, thank you, in a very nice way. So the 1970s was a shift in retirement from defined benefit to defined contribution plans. And then I said in 1980, we're going to have to do that to health care. Well, we're doing it, but we're doing it 40 years later. In 1999, I got involved with the healthcare system firsthand. Up until 1999, I was single, healthy. I never had to deal with health care. When I worked for the federal government, the White House paid my health care. When I worked for Citibank, someone else paid my health care. And frankly, I didn't use much health care. But in 1999, my wife was pregnant. I had just gotten married. And we had to move, and net, we lost our group health policy through a change of state and a change of me from an employee to a director of a major Wall Street firm. The net of it is, in 1999, I lost my health insurance group. My wife was pregnant. I'm an economist. What do economists do? They crunch numbers. And I crunch the numbers and say, wow, Lisa, if our baby's born premature, and premature babies live today, it's going to cost about 60 grand a day, and it'll take 60 days before they give up on the kid. That's $3.6 million. I'm going to take $3.6 million and put it away and keep it liquid in case we got to pay for the hospital for a premature baby because we have a baby uninsured. Now, I was pretty well off. I had taken some companies public by 1999, and I could afford $3.6 million. But I started asking myself, what do my employees do? What does the average American do when they fall out of health insurance? And that's when I found out that health insurance was the major cause of And it's really a shame that President Obama and other people doing health care reform didn't know that, because I would have liked to see us beef up those state risk pools versus come up with this federal health insurance plan. Now, we could take more questions about that, but I'm trying to stay off politics here. 2007. In 2007, I had started Zane Benefits. And a little background and history here, you may remember, those who follow me closely. In 2005, Steve Case, the founder of AOL, bought 2/3 of Extend Health from my group. At that point, they fired me from Extend Health. I waited a year until my non-compete expired, and I built Zane Benefits. And Zane Benefits is a pure software company. What Zane Benefits does is it takes tens of millions of dollars of healthcare technology and gives it to two-person employers or sole health insurance agents. And Zane Benefits is a software platform that makes every health insurance agency into an Extend Health should they want to be. And we're very proud of that. We have over 2,500 different insurance agencies who use Zane Benefits software. And we're like you, but we think the ability for an employer to give an employee money to choose their own health insurance is the biggest story I am telling the American business person in my 5 years as editor-in-chief of the Wall Street Journal. And the reason was that it wasn't just reforming health insurance, it was reforming health care. Because ultimately, if people spend their own money on health insurance or get to keep what they don't spend, like in a defined contribution model, they're going to be very efficient about choosing health insurance. They're not going to protest as they are in Chicago screaming, we want more health insurance, like the teachers are today. Instead, they're going to protest, we want money, and we'll decide how to spend it. And if we get to keep what we don't spend, we'll probably choose higher deductible and better policies. So 2007, while it's not the year we started Zane Benefits, we started in 2006, that was the year it was the front page of the journal. I encourage you all to read the story because many of the debates and arguments in that 5-page story on the front page of the journal with my photo, that story is really more relevant today. In 2009, the IRS extended the ability for employer money to go to personal policies or individual policies with PRAs. And of course, we're talking about throughout this whole webinar, individual policies became guaranteed issue or become guaranteed issue in 2014. Let's go to the next slide. Okay, let's talk about health insurance. I'm going to switch gears here and talk about the problem today with health insurance. The problem that everyone complains about is not that health insurance is bad. It's actually a pretty good system. The documents work, the insurance policies work, the carriers work. What's wrong is the cost. The cost of health insurance is so ridiculously expensive that unless the carrier mandated 75% or more of the people buy it in an employer group, or put another way, it's so ridiculously expensive that unless the employer paid 75% or 100% of the employee, nobody could afford it. And so the main thing wrong with health insurance is it costs too much. And if you look at this slide, it's really astronomical. I mean, think of what in your life has gone up from $5,000 to $15,000 linearly straight through in a decade. It's absolutely incomprehensible that something in our society in the last decade, from cars, houses, anything, in fact, they've all been flat or gone down with the exception of healthcare. I always say we'd actually have deflation in many areas of the economy if not for healthcare costs, but healthcare drives everything. And of course, employers offer insurance and they whine about it, but as the cost got astronomical of health insurance, employers love it because with their tax advantages, they use this for recruiting and retention. It's defined today that a good job comes with health benefits. Just ask anybody's spouse who's trying to raise kids, male or female. If my husband or wife had a good job, it would come with health benefits. And of course, it's tax deductible to the business. Employees get the benefit 100% tax-free. And individual health insurance, we came back before, is not guaranteed issue. So I wanted to focus on this to show you the enormous cost rise of health insurance before I show you what's coming. Next slide. Who's got the map? Oh, you do. Good. Next slide. The real problem, though, is not the cost of U.S. health insurance. The real problem is the cost of health care. This month, Forbes just this month crossed $3 trillion in health care. We currently spend $3 trillion on health care. I have to really put what $3 trillion is. $3 trillion is about 20% of our GDP. That's up from 4% of our GDP in 1961. So we've increased the proportional share of our economy 5 times and increased the numbers to an enormous, enormous level. And employer health insurance, I believe the first bullet drove up the cost of health care. When's the last time you asked the doctor when he prescribed a test, doctor, how much does the test cost? And is there a cheaper test? Is there a test I should take more often? Is there something I can do in lieu of this test? Doctor, what are you going to find if you find this test is positive? Oh, you're going to give me a pill that costs $12? Why don't we skip the $10,000 test and give me the $12 pill? The doctor says, but then we'll never know if you had it. I don't care. I want to get rid of it. You see the dialogue. In effect, employer health insurance with massive tax subsidies for the employer and the employee caused the problem. Back before World War II, when a doctor prescribed something, they talked about the cost when he prescribed it, and the patient and doctor made a cost-benefit decision. But nothing more than employer, third-party payer, you don't care, all these massive tax subsidies drove the cost of health care to 3 times other developed nations. It gets worse than that. I analyzed a lot of work by Regina Herzlinger, who's a colleague of mine at Harvard Business School, and she's probably the most knowledgeable person in the country about health care. I claim I know something about health insurance, but I tell people I'm not a biologist. I don't know about health care. Professor Herzlinger at Harvard, she's the expert, and she wrote a book, Who Killed Health Care? She writes about health care. And the New York Times editorial page gave me that last bullet. The New York Times says that 50%, that's 50%, of medical procedures done in hospitals and doctors' offices do more harm than good. I know none of us have gone through an operation. I had a minor back operation a few years ago, thinking it's going to do more harm than good, but that's the reality. More than 50% of the operations done don't work or do more harm by definition of being an operation. And at some point, we need to look at the macro numbers. We are completely out of control on healthcare spending. The problem is no problem with U.S. health insurance. The problem is the problem with U.S. health care, and insurance is just what we use to pay for it. But the problem with U.S. health care is not just the runaway cost items. Next slide. The problem with U.S. health care is obesity. Can I yell that louder? Obesity. The real problem in the U.S., when you analyze why we spend 3 times the cost of other developed nations, is obesity. And let me just give you a little perspective. 2 years ago, I'm told that the Premier of China read my book on obesity, which is really called The Wellness Revolution. And it talks how the U.S. population in the wellness revolution is bifurcating itself into have and have-nots, mainly starting with a waistline. People who are obese earn less money, they are more poor, they have rough lives, and that's already 33% of our population. People who are not obese, including brothers and sisters in the same family, have much better lives economically. I've been writing that for 15 years in a series of 4 books called The Wellness Revolution, but as my wife said, they're really called The Obesity Revolution, and not in a nice way. The real problem in U.S. healthcare is 3 times the cost of other nations is obesity. And I'm very proud to tell you that I have addressed the entire Chinese nation, from the Great Hall of People, the center podium, talking to 1 billion people about the cost of obesity. We spend, at the time I started writing this, we spent more treating obesity than the Chinese spend on everything. I know that sounds pretty obnoxious, but $2 trillion, I believe, of our $3 trillion healthcare is treating cancer, heart disease that are the direct result of obesity. We are currently 33% obese as a population, that's medically obese, and we're 66% overweight. These are enormous numbers. And I was in Brazil this summer, and I've been to India this summer. I don't like leaving my 4 kids and going to Brazil and India, but when I can address that nation and that media and tell them what's coming to their personal lives and the cost on obesity, I feel I'm doing good work. And I'm proud to say I'll be in the EU, in France, and in Germany in the next few weeks, again talking about wellness, which is really a buzzword for obesity, because these countries are looking at what we spend on the U.S. on obesity, and they're going, this is barbaric. And it's not just we spend 2 of our $3 trillion healthcare budget treating obesity, 3 times what we should be spending. It's also that the people who are obese have really rough lives, and they subject their children and their families to needless suffering. It's not a joke anymore. It's a terrible, terrible disease, and we need to stop fat jokes and anything we do about obesity and attack this with the same way we just got Osama bin Laden, because most of our lives are made much rougher by someone obese in our family than any type of terrorist activity. The ultimate terrorism is to destroy your life by being obese. I'll slow down a little bit. It's not my major issue, but I really can't talk about health care without talking about the real reason we spend 3 times what we should in health care. We should spend $1 trillion just like Europe does, proportionally. Instead, we spend $3 trillion. Why? It's obesity. I'm going to pause now a moment. Some of you probably want to yell at me. Some of you may be obese and are insulted. If I've struck you to take action or to go to a loved one, I'm glad I've done. I'll shut up about obesity and return to health insurance in the next slide.
And this next slide is a comparison of the U.S. healthcare system compared to China, which Paul is very familiar with. We have gotten many questions regarding today's presentation, whether or not it will be available to you after today's webinar. The answer is yes. You'll be provided the slides based on your registration today, and we'll be happy to notify you when that does become available. So for those of you that have had to jump off and have asked the question, these will be provided to you at the conclusion of today's webinar. Paul, if you want to continue.
Okay, so the cost of U.S. health care, to summarize, is really amazing. At 314 million Americans, that's our population as of this morning, we spend $3 trillion. Let's do a little division. Take 3 trillion, 3,000 billion, divide by 314 million. That's $9,500 a year cost on health care per capita. In China, they spend $8,500 a year GDP on everything. Actually less, because they take about $1,500 a year per person and give it to the United States to subsidize our life. So China spends $7,000 a year on everything. And China, by the way, is not some backwards Chinese country today. China has missiles, nuclear power, incredible cities that, are unbelievable in infrastructure. And China supports their whole economy for less than we spend on just health care per person. But now let's look at the 314 million Americans and their health care spending by groups and see what we see as business opportunities. Remember, I promised you I won't just ramble here economically. I will talk about specific business opportunities within these numbers. Next slide, please. How 314 million Americans at 9,500 American get their health insurance? 214 million are what I call public sector. And that group is roughly, I know Medicaid is 52 million and Medicaid's 48 million. And then there's another 14 million I call in the VA, some people falling through who are uninsured. Roughly 114 million are the public sector group. About 200 million Americans get their possible. Next slide. So review this again. If you have clients who have employers in group plans, now is the time to say until healthcare reform takes effect. And remember, we don't sell any health insurance over here in benefits, so this is not our personal piece here. Now is the time to move them to an individual policy and taking their premiums from $500 a month on average to $250 a month. And actually, it's usually a much greater thing depending on your state. Their residing on an individual plan only has to last 1 year through 2014 before all plans become guaranteed issue. There's amazing arbitrage opportunities now to buy 1 year short-term coverage. Everyone says, who would buy 1 year short-term coverage? What a waste. What if you get to the end of the year and you can't renew it? Well, there is no end of the year because coming December 31, 2013, all policies are guaranteed issue. And for many employees, when you get specific, guaranteed issue is here today. Let me say that again. For many employees, guaranteed issue is here today. So when you take a group of 50 or 100 or 10 people and you go person by person through the group, you'd be amazed how many people are already at a guaranteed issue level or they're healthy, and now's the time to switch to individual plans, saving the employer 50% or more. Or from your end, it's getting a new employer onto your business because their old agent's not offering this. And those are the 4 items you see here. State risk pools are greatly improved. Diff state programs are going to have to cover them state by state. PSIP is enormous. PSIP is short for 6 months because they just entered the labor pool. They didn't need continuous coverage, they didn't have HIPAA protection, and their employer has a 6-month waiting period. Well, after 6 months, don't go on the employer plan, go on the federal government plan. Next one, next slide. If you're in a group plan, as I mentioned, you're paying $6,000 a person, switch to $3,000, and this just reiterates and gives a little more elaboration on what I said before. Employers still need some type of health care plan for the double R's. The double R's to us are recruiting and retention. Employers whine and complain, but when it comes down to it, they like saying, I got to recruit employees and I put health benefits in all my employee ads. I've got to retain people, and they've got to know when they leave me, haha, they leave health insurance. And of course, they can still offer that with defined contribution, particularly for healthy employees, and save a great deal of money. We talked about guaranteed issue. The old reason you didn't go individual plans, well, some child with leukemia won't get covered. Well, today they get covered by the state or federal government, not by you, because you don't have that problem in your group plan. 2 is PSIP. We've already talked about PSIP. That's the federal plan. It's better than group plan coverage. And, of course, 2014 is right around the corner, and this is the final year to grab that 50% savings on the arbitrage opportunity. Next slide. In 2014, everybody asks me this. I don't have any crystal ball, but they say, what's going to happen with health care reform? Even though, you may remember, the Supreme Court ruled health care reform is as it is. So here we have a bill passed by both houses of Congress, signed by the President of the United States. We have a bill that was challenged at the Supreme Court level. And the challenge was successful, but only on Medicaid. The guaranteed issue and all the other items stay the same. Occam's razor is one of my favorite laws in physics, which basically says the most simple, obvious explanation is probably correct when you're faced with many choices and many outcomes. The most likely simple on Occam's razor is probably correct. Well, guess what? The bill's been passed. It's been signed by the President. The most likely simple thing that's going to happen is nothing. It's going to sit there and be implemented, and now's the time to get with the program, switch to defined contribution, get employers on, because it's a huge benefit to the majority of employees through tax subsidies on defined contribution policies. Number 2, nothing happens, meaning there's no health care reform. Why? The bill's repealed by a Republican win. There are people probably on this call who would like to see Romney win, the House win, the Senate win, and then the Republicans would still have an interesting time trying to repeal a major bill. I'm trying not to say this is good or bad. I just don't see this really happening. But if it does, the arbitrage opportunity of 2013 lasts another full year. Years and years we could end up in. And the same thing could happen in, well, we finish. So in number 2, nothing happens, is if the bill got repealed by Republicans, then the arbitrage opportunity I've discussed and defined contribution just continues on its merry old way, and the right decision you made for 2013 for your clients is going to be the right decision on and on. And of course, limbo happens is very simple. My analysis, this is my personal view, is that the money is not in the federal budget to implement health care. And remember that coming up on 2000, I think it's 15, we run out of money again, meaning they shut down the government. And when we run out of money and shut down the government, they can't implement health care reform. In fact, they can't implement it now because it's not in the budget. When I run the numbers of health care reform, I actually come up with $1 trillion cost. And the reason I'm different than the GAO is the GAO assumes that 40 million people who are not buying health insurance are going to all of a sudden buy health insurance. I don't believe that 40 million exists, or I believe they're very poor, they don't have any money to buy health insurance. I believe that what's going to happen is very similar to the Long-Term Care Disability Act, which I can take questions on, but people may remember that in 2010, there were 2 bills passed, March 9th and March 10th. On March 9th, we first passed the Long-Term Disability Act in honor of Teddy Kennedy's lifelong commitment to long-term care. And then on March 10th, we passed the Affordable Care Act, meaning health care reform. The long-term disability was supposed to be implemented in 2011. The President signed it by executive order saying there's no money in the budget, we're not implementing it, end of story. So we have a bill passed to have federally guaranteed long-term care, and in 2011, 3 years later, the President signed a statement saying there's no money, I'm not implementing it as executive. Very similar to what President Obama did with illegal immigrants who really aren't that illegal, but they're illegal, meaning they're illegal immigrants legally, but they were virtually born in the U.S., meaning they got here 2 days after their birth, they haven't done anything illegal, and there's 12 or 14 million of them about to be separated from their families and shipped back to some other country. And what happened? The President said, I know it's the law, but I'm not going to enforce that law by executive order. And he got away with that, and probably a good thing he did. Well, very similar, that already happened on long-term care, and that may happen in number 3. So again, this windfall arbitrage opportunity to switch people individual plans might continue on and on and on in number 2 and number 3. And we can take more questions on that in my opinions of 2014 and beyond. But you guys should be focused, in my opinion now, on the last quarter of 2012 and 2013 for your clients, because now's the time to get very specific and get your clients implemented and on the defined contribution bandwagon for healthcare. Next slide. Summary. The summary of the Affordable Care Act looks this way. Again, there's no lifetime max on a policy. There's preventative care, and there's a federal guaranteed minimum policy. But now look forward at the employee for a family of 4. Here is typical income of a working person buying health insurance after 2014. The cost of health care, I estimate, for 4 people is about $24,000 a year, $6,000 a person, because they're in the working group. If I put them in the non-working group, it would be somewhere around $48,000 a year. The government premium subsidy, look at column 4, is $15,000 or $21,000 or $24,000 based on their income. And these numbers aren't backed on ratios. The actual bill passed by Congress in 2010 said that if you earn $40,000 a year, you cannot pay a penny more annual premium than $2,178. If you earn $80,000, it's $8,360. And the government will pay the rest through exchanges. This is such an enormous amount of money in the subsidy that every employee is going to buy an individual plan, every employee is going to go for the federal subsidy, and all the employer is going to do is use defined contribution, frankly, I don't mind saying, hopefully our software, to reimburse the employee for the individual plan. Next slide. Let's talk specifically about large and small employers as a prelude to any questions on this. Employers with less than 50 employees, full-time equivalent, no penalty. So if you're an employer who just says, I want to have my employees have that subsidy, I'm canceling my group plan or I'm not going to start one, bingo, I'm not going to have any penalty. What a windfall for me. Now keep in mind, when this bill was debated in 2009 and 2010, the White House wanted a $10,000 employer penalty. The Senate wanted the actual House, and that's a misprint here, wanted a $20,000 employer penalty. We want to get those employers who don't pay for health insurance. The Senate said, wait a minute, if we put in a $20,000 employer penalty for not having group health insurance or health insurance, these employees will just leave. You can't run a business from McDonald's through my wife's Planet Fitness business, through any kind of business, where you're paying more for health insurance than the whole cost of labor. We'll just close the company. Or if it's a manufacturing company, we'll just take it overseas. So effectively, employment trumped health care, and the bill became a very small or no penalty at all for employees under 50, and a very minimal penalty. They took a zero off it for greater than 50. For employers greater than 50, they wanted a $20,000 penalty per employer if you don't have a group plan, and they lowered it to $2,000. Already we've seen memos here. Is that in my slides, the McKinsey slide? Can we leave that in? We already have seen memorandums, and your Zane Benefits account rep can provide them if you want, that AT&T, 1 million employees, Verizon, 1.1 million, have already leaked out. They are canceling their group plan and willingly and thrilled to pay $2,000. They don't call it a penalty. They call the $2,000 my contribution to everybody in my employees' health benefits. I'm going to give $2,000 an employee. That's $2 million, $2,000. That's $2 billion on my million employees as the contribution for them to buy individual policies in the exchange workplace. And that's where we are in 2014 Affordable Care. And next slide. Okay, so summary, let me run through the key points we've covered here today, and I'll have a little bit of time for some of your questions. The core problem is that employer health insurance costs too much. But the real problem, number 2 bullet, is that health care costs too much. And we need to focus on the real cost of health care, which is really obesity. I mean, I'm sorry to smack that in everyone's face, but that's the real reason we spend 3 times the amount on health care. Health insurance cost is just a symptom. Health insurance exists today and will continue, employer health insurance, because of massive subsidies in the employer market. And those are the tax subsidies. None of that changed. This 3rd bullet, nothing changed in health care reform, nothing regarding IRS, tax deductions, employers deductible, non-taxable for employees. So just as you've always heard growing up in America, a good job comes with health benefits, that's going to be the same, only it's going to be defined contribution health benefits where you go choose your own health care. In 2002 and 2009, defined contribution plans will level the playing field for individual. We've already covered that pretty well. In 2014, Affordable Care Act creates a major cost advantage. We're talking like 8-10 to 1. For individual health insurance, we expect all employers, large and small, to switch to individual plans. And growth of 2014 and beyond, I see the death of employer group health insurance. To me, that's a good thing. Just as I saw the death of employer benefit plans, where companies used to raid their own pension plan from their former employees to fund their own boondoggle projects. This was back in the 60s and 70s. That led to ERISA. We finally got employers out of the benefits retirement business and moved to defined contribution retirement benefits. We are now moving fully to defined contribution health benefits. We're going to get employers out of choosing what their health benefits are for their employer. You're going to lose your job. That's enough of a trauma. You won't have to worry about losing your health insurance. Well, you will have to end up, figuring out how you pay for it. But finally getting health benefits away from employers, I consider a major, major boon. I'm taken back to 1985 when I had my debate in Moscow, and I was very embarrassed to be an American when I learned that you lose your health benefits when you lose your job. And I'm thrilled that we are moving towards the death of employer group health insurance post-2014. Can't help throw you my last personal 2 cents here. And JD, why don't you help me get through the next? I'm happy to take a few questions here. I probably think I ran over.
Yeah, we've gone a little bit over, but we will spend between 5 and 10 minutes here answering some of the questions that have come in throughout today's webinar. And Paul, I'd like to take it to a very common theme and question across today's webinar is, would you please address the potential for changes to healthcare reform, the potential for it being repealed or changed in some fashion leading up to 2014?
Can we go back to that slide I had that's exactly on that? And I think I covered it in the slide, but I might as well hit it again. Occam's razor, back up. All right. Occam's razor, look it up in physics. The most logical, easy explanation is the most likely. So when faced with 2, 3, 4, 10 outcomes, don't get complex, look for the simple one. I believe that applies here. Healthcare reform was passed. Healthcare reform will be here. With all respect to my Republican colleagues, and as you know, I've served mainly in Republican administrations, I just don't see it going away, at least by January 1, 2014. And even if we have a Republican president and a Republican Senate and a Republican House. They're going to need 60% majorities. They're going to need a lot to get rid of health care reform, and people will go nuts once they think, you know, it's like watching Chicago. Chicago is not burning, but it's close to today. At least it's burning emotionally. There's no money. Someone needs to figure that out. And I don't see the health care reform bill going away. That's Occam's razor. Separately, if it does go away, there's status quo continues where it is. And I talked about limbo. Health care reform might not get implemented because the subsidies might not get implemented. So despite what I just said about number one, it's not going away, personally, I've run those budget numbers a lot. I don't see the money there for the subsidies. And then we get into a very interesting discussion of what happens to health care reform without the subsidies. Let's take a moment on that. I believe that guaranteed issue is a Pandora's box that was the wrong thing to do, but it's done. And I don't believe we're ever going to get rid of it. So when they come in 2014 to a new Republican administration, if that's the case, to a Republican Congress, to a Republican House and Senate, I believe it's going to be very difficult to get rid of guaranteed issue because people are going to want guaranteed issue. And if guaranteed issue is here, it's going to fundamentally just drive everything very rapidly towards defined contribution policies, which I think is a pretty good thing. So, and number three, if we run out of money, we may run out of money for subsidies, but in some ways we may move towards a federal guaranteed issue that supersedes all the states, and that could be something good. Right now, most people in this call should be worried about fourth quarter 2012 and most important implementation in 2013, moving towards defined contribution, and let's say come what may in 2014. All roads of 2014 say that you're better on defined contribution the earlier you get there.
Funding for healthcare reform is a common question, and where that's going to come from and how you anticipate that being done.
Funding for healthcare reform, that's our problem with number three. I'm the one who's pretty much rang the alarm bells that the funding's not there for healthcare reform. I really don't know. The key is they've got to get some of this cost on the private sector and away from the government because the government doesn't have the money. And it's going to be very interesting to see what we do with the budget and budget deficit. If I jump out of healthcare for a moment, this is going to sound revolutionary and talk as an economist. What I'm telling my major clients is I expect to see interest rates at zero indefinitely. So for the next 5, 10 years, or at least 10 years, I expect zero interest rates. What that means is we as a budget have an enormous amount of money. And by that, the federal government has a $16 trillion GDP. Our entire interest costs, because interest rates are at zero, are $232 billion. If that continues, and I'm right on interest rates, we have a lot of money to fund health care reform and fund a lot of social programs that we didn't think we had the ability to fund because we're not adding any interest to the debt, and the money we're borrowing from China and anyone else is free money. I mean, how much money would you borrow if I told you you could borrow money and you never have to pay interest, ever, or at least in your lifetime or your children's lifetime? You just borrow and borrow and borrow, free interest. And that, in effect, is where we are. So we may have the money for health care reform because interest rates stay at zero. I know that isn't about health care, but I had to jump in there to give you my opinion of fiscal policy and where we are on interest rates and how that affects a virtually unlimited U.S. federal budget, because the rest of the nations of the world are lined up, or they're wealthy people from Indonesia to Venezuela, or starting with Indonesia and Venezuela, but all the way through EU, are saying, how can I give my money free to the United States because they're the only ones I trust to pay it back?
In essence of time, we'll do one final question here. It's a good one, and your view on the health insurance carriers and how health care reform affects them and just the impact of the Affordable Care Act on the actual health insurance carriers.
The health insurance carriers are not going to be as impacted as everyone says, because you have to put some things in perspective. First of all, most health insurance carriers are administrators. Most of their business is not insurance, or at least past a year. Their business is taking the cost from someone else, generally employers, and passing that money from employer to doctor or to medical provider. And you see that all across the board, where our president's made several mistakes when he goes after insurance carriers, and he finds out that 75% of the people in group plans are in self-insured plans, because large companies are all self-insured. If they're not self-insured, they're self-insured within the year because you get a premium increase based on your medical cost increase. Our real problem is rising health care costs. Our carriers do nothing more than take the health care costs, add in their overhead, add in their salaries, and pass that on to employers and a little bit to individuals. and that's going to continue. So when we think carriers are going to go broke, they're going to quickly retool. They're already retooling, and they put things together. Our problem is health care costs in this country is 300% high, and the insurance carriers actually make money on the higher cost by passing it along, but they're not like life insurance companies who make a bet on somebody at 30, 40, 50 years old and are stuck with that bet for the next 50 years. They retool and realign their premiums every year. So I do not expect this massive health insurance carriers going broke, and as long as health care costs keep rising, they're part of the problem because they just pass along the cost.
Well, that will bring us to the conclusion of today's webinar. I did have lots of questions here that obviously went unanswered. If you do have any further questions, don't hesitate to give us a call. I know we've worked with many of you directly. If you have a Zane sales manager here at Zane Benefits, don't hesitate to give them a call, get a clarification on a question that may have gone unanswered today.
Good. Well, this is Professor Paul Pilzer. I've really enjoyed this today. I enjoy your individual questions. I'm actually going through them all. I see so many, hundreds just came in. And thank you very much for your time. These are very, very exciting times. Great opportunity for all of us in the health benefits business as we maintain this amazing switch to defined contribution, which I see as the panacea for so many problems with our healthcare system. Thank you.
Paul, thank you for your time. Thank you for everybody's time in attending today's webinar.
1-year-old Gianluca is getting a well baby exam here at Salt Lake County Clinic. Parts of it he doesn't like very much.
It's incredibly important that
Dr. Wendy Hobson-Rohr says regular care is important for kids, and kids with insurance get more care.
So if they have insurance of some type, which would be if it's government sponsored by Medicaid or CHIP, they'll come much more frequently than if they're uninsured and don't have any coverage.
For millions of kids like Gianluca and his sister Filardia, insurance costs are paid by the Children's Health Insurance Program, called CHIP for short. It pays for families who make too much to qualify for Medicaid, but too little to afford insurance.
The Obama administration likes the CHIP program, and the Affordable Care Act won't change it very much. The big change is to get more kids like Gianluca here into the program.
Now, just over 8 million children are on CHIP, but there are almost 5 million more children who are eligible for CHIP but haven't signed up. The Obama administration wants to get every eligible child onto CHIP.
All children should be on an insurance program.
Now, CHIP costs are shared by federal and state government. The Affordable Care Act says the federal government will pay more than 90% of all costs. That will encourage states to recruit more kids onto CHIP, and the federal government will help pay for aggressive recruitment. The Obama administration estimates it will cost $113 billion from 2012 to 2020 to get all kids insured.
Not an insignificant amount of money.
But Utah Governor Gary Herbert notes Affordable Care Act cost estimates have gone up a lot already. And in the past, government health care costs have been off by as much as 10 times.
I hope we're not off by tenfold on the Affordable Care Act. If we are, we're in deep doo-doo.
Everyone believes health care is good for kids, but some people still doubt whether the Affordable Care Act is the best way to get that care. Rod Decker, Salt Lake City.